Welcome and thank you for joining us on Birth Mother Matters in Adoption with Kelly Rourke-Scary and me, Ron Rains, where we delve into the issues of adoption from every angle of the adoption triad.
Do what's best for your kid and for yourself, because if you can't take care of yourself, you're definitely not going to be able to take care of that kid, and that's not fair.
And I know that my daughter will be well taken care of with them.
Don't have an abortion. Give this child a chance.
All I could think about was needing to save my son.
My name is Kelly Rourke-Scary. I'm the Executive Director, President, and co-founder of Building Arizona Families Adoption Agency, the Donna K. Evans Foundation, and creator of the You Before Me campaign. I have a bachelor's degree in family studies and human development and a master's degree in education with an emphasis in school counseling. I was adopted at the age of 3 days, born to a teen birth mother, raised in a closed adoption, and reunited with my birth mother in 2007. I have worked in the adoption field for over 15 years.
And I'm Ron Rains. I've worked in radio since 1999. I was the co-host of 2 successful morning shows in Prescott, Arizona. Now I work for my wife, who's an adoption attorney, and I'm able to combine these 2 great passions and share them on this podcast.
Coronaviruses are a group of related viruses that cause diseases in mammals and birds. In human, coronaviruses cause respiratory tract infections that can be mild, such as some cases of the common cold, and others that can be lethal, such as SARS, MERS, and COVID-19. Symptoms in other species vary. In chickens, they cause an upper respiratory tract disease, while in cows and pigs, they cause diarrhea. There are yet to be vaccines or antiviral drugs to prevent or treat human coronavirus infections. OSHA's website states that according to U.S. Centers for Disease Control and Prevention, Chinese authorities identified the new coronavirus, which has resulted in confirmed human infections in China and a growing number of other countries, including the United States. Infected patients have also spread the virus to healthcare workers. According to the World Health Organization, COVID-19 is now a pandemic, meaning a global outbreak of disease. On March 13, 2020, the President of the United States declared the COVID-19 outbreak a national emergency. The virus that causes COVID-19 seems to be spreading in the community in some affected geographic areas. Community spread means that people have been infected with the virus in an area, including some who are not sure how or where they became infected. The WHO states on their website that coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down the transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it is important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. The WHO will continue to provide updated information as soon as clinical findings become available. So the main question is, how will COVID-19 impact domestic adoptions? Today on Birth Mother Matters in Adoption, we're going to jump right into these questions. Please understand that we're solely speaking on behalf of Building Arizona Families Adoption Agency and AZ Pregnancy Help located here in Arizona. We can't speak for how other agencies are handling adoptions or what their state regulations and guidelines are concerning COVID-19.
So because of the stay-at-home order, we're sheltering in place. Ron, this is the first time that we have done a podcast where we are not in the same room.
Yes, it is. And it's been a while since we actually recorded. Thankfully, we had some in the bank and we could, just kind of plug those in. But so this is the first time we're doing a podcast since the coronavirus outbreak.
It is. And it's a new experience for us. So I hope our listeners will kind of wade through the waters with us in terms of sound and quality. I know that we both have a lot to say about this and how it's impacting our lives and adoptions and I guess the whole nation, the whole world, really.
Absolutely.
we've made it clear over and over again, we're in Arizona, and we are just going to be talking about the specifics of building Arizona families. We can't attest or answer to what other agencies are doing or the protocols that they have, because I know that the governors are stipulating certain things in certain states. And in Arizona, obviously, Doug Ducey has made his list. And I'm actually going to upload that document, the order that he has issued, to our new website. So that way, anybody who is not from Arizona and is going to be coming to Arizona to do an adoption can read through the order, just so they understand what's going on and what our laws and restrictions are.
Okay, and so that does bring up a question. As far as people that are doing interstate adoptions with Arizona and building Arizona families, how does that affect? Because are they able to travel from state to state, for instance?
For right now, yes, that is not that hasn't been an issue. So let's go back to the start, and let's address all of these, because these are really important topics and concerns. We're getting a lot of phone calls from families in our program. We are an essential business, so we are still open. Just a quick background of how we are running things. Our workers are obviously at some point out in the field. The ones that don't have to be in the field are working from home. We are having our office sanitized every day by a cleaning crew that comes in. We are keeping everybody as far apart as possible. When our workers don't need to be at the office, again, they are not. They are working from home. That way they can shelter in place and keep everybody as separated as possible. We're also, unfortunately, not able to attend doctor's appointments with our birth mothers any longer. The doctor's offices are not allowing a support person to go back. And again, they're just trying to minimize exposure, and they want everybody to stay apart and stay safe.
Certainly.
So that being said, it's really impacted how we case manage. We have found some really good tools that we're using, and we're going to talk about all of that. We have been able to provide the same level of support, but just through a different means. This has really impacted so many lives. And I know that it started back in January, but I guess I just wasn't up on the news. I'm so busy in the world of adoption that, to me, it felt like COVID came out of the middle of nowhere.
When did you start really noticing it? Just the beginning of March?
Yes. Unfortunately, I would love to say that I had been tracking it and following it. But again, we have been so busy with so many babies being born and so many birth mothers coming into the program. And, my focus has always been my family and adoption. And so I wasn't, tracking the potential of what this could occur. Not that it would have changed anything. I wouldn't go back and do anything differently. I think I would have just liked more of a heads up.
Be a little more prepared for what was coming. I don't think anybody really was, though. I mean, we saw it from another country, and they were saying, oh, it's bad there, but it can't really hit home until it literally hits home. I mean, it doesn't sink in until, whoa, this is starting to spread, and fast.
Absolutely. And I think what's so frightening to me is it seems like it's almost this silent, it's obviously you can't see it coming. And if you read one website, they're recommending, this, wash your hands, after, you can live on cardboard for a day. And then another website will say 4 days. And then everything is just, it's a lot of the unknown. And I guess that's the scary part.
Right.
How long is this going to last? How many people are we going to lose? Is it going to come into our homes? Is it going to ever go away? Those are things that just go through my mind, and I'm sure go through everyone's mind.
And, you watch how it's affecting the economy and people's lives in that way as well. And people are suffering in so many different ways from this. So, yeah, this is our Great Depression and World War II kind of rolled into one, you know?
Right.
This will change our lives.
I think it will. And I think it will for a long, long time in some aspects. I wonder if in some ways maybe the silver lining will be that it makes us all slow down just a little bit. Mm-hmm. Maybe it'll help our country come together more and solidify.
That would be nice.
It will, be a move towards world peace. Who knows? Who knows what positive things will come at the end of this. I guess I'm really trying to find the lemonade at this point because there's a lot of lemons. There really is. And we, meaning the Building Arizona Families domestic team, a lot of us have children and they've closed the schools down now. So our children are being not really homeschooled because it's kind of an online school, but yet you're still a teacher per se. And so then you're wearing another hat, but yet you're still working full time. And, I'll be working at my computer and my 8-year-old is standing over me with his laptop asking me how to Zoom actually. And that was how I learned how to Zoom, Ron. That just clicked.
Which is how we're doing our podcast this time, right? That
is, yes. He's been Zooming with his teacher and his classmates.
So you should have had him teach you.
I should have. So he has been Zooming. So I'm trying to help him log in, and and I'm working at the same time, and I'm thinking, this is our new reality for now. And it feels like it just changed overnight.
It's just unprecedented for all of us.
Has it impacted your life a lot?
In a weird way, it hasn't. Because, as you know, Lisa and I kind of live in a more rural area, and we don't get out much. We usually don't even go grocery shopping for a couple of weeks at a time anyway. So we're trying to even slim that down. But we've been working from our homes for years now. And so, no, it hasn't impacted us as much as it has others. And, that's just kind of a blessing for us. But still, we see it going on all around us. And I'm trying to keep people from coming to our house, whether it's family members or anybody else. It's like, you know what? Stay at home. If you need to bring us something, leave it outside the door. We'll leave it out there for a couple of hours and kind of sanitize it when we get to it. But by and large, we have been minimally impacted ourselves, fortunately.
What a blessing.
Yeah, it really is.
We have been impacted more than that. Again, 6 of our children out of 7 live at home. Mm-hmm. And so all 6 of them are at home. They're all going to school, and all of their activities have been cut. All their athletics have been cut. They can't see their friends. They can't go out, and they're really struggling.
Yeah.
4 of them are teenagers, and this is like one of their worst nightmares.
Absolutely. I can't even imagine being a teenager in this time with all these immediate changes that are so drastic. And it's like, stay in your house, don't hang out with your friends, don't go and do anything. And yeah, that's got to be horrible for them.
Yeah,
and
definitely.
For you, as a matter of fact.
On some levels, at some points during the day, yes.
Here's a brief timeline on what's happening here in Arizona so that you can understand how Building Arizona Families is handling this pandemic. On March 11th, the World Health Organization declared COVID-19 a pandemic. March 12th, Arizona Governor Doug Ducey declared a public health emergency and gave staff officials more leeway and tools to deal with the coronavirus outbreak. On March 15th, Governor Ducey and the Arizona Superintendent of Public Instruction, Kathy Hoffman, announced all Arizona schools will remain closed through March 27th. The United States Centers for Disease Control and Prevention recommended that no gatherings of 50 people or more take place for the next 8 weeks to slow the spread of coronavirus. On March 21st, all non-essential or elective surgeries, including dental surgeries, that use personal protective equipment or ventilators should not be performed at any licensed healthcare facility or by any licensed healthcare provider in the state of Arizona. Also, the state is delaying the requirements to renew driver's license and driver's permits that have an expiration date between March 1st, 2020 and September 1st, 2020 by 6 months from the expiration date. And on March 30th, Governor Ducey mandated a stay-at-home order that went into effect on Tuesday, March 31st at 5 p.m. and will last through April 30th. According to the order, Arizonans should limit time away from home except for essential activities. Essential activities are broadly defined to include working in essential jobs and exercising outside.
So I think that when we look at adoptions and we look at how we are structuring this, we definitely wanted to make sure that we adhere to all of the state regulations and our licensing regulations as well. So we are absolutely keeping in tow with both. And so what we're doing, our protocols, and we have sent out letters to the adoptive families that we're working with. When a family is matching with us, we're letting them know the changes. And these are not permanent changes. They're just as long as this pandemic continues. And then when we get the all clear, we will transition back to the more face-to-face intensive case management approach.
Right. Now, what do you do as far as like transferring money to these girls when they need it? How does that work?
So the way that it's working now is we are having a lot of our birth mothers sign up for different avenues for direct deposit, because if we ever get to a point where we're not allowed to go out. Now we are able to deliver their weekly funds. We are able to do that at this point. And so right now it's not an issue, but in preparation, if that ever becomes a point to where we can't physically get to them because there are barriers or something, we are getting them all signed up so that we can just deposit right into their account. So that's what we've been working on.
Has that been difficult? Because I know that some of these women are homeless or don't have a permanent like residence or bank accounts or things like that. Has that been an obstacle that's been easy to overcome or not?
There are avenues like the Green Dot card and Chime and things like that, that you don't have to have a credit rating per se in most cases in order to be able to qualify for one of those. Okay. So that being said, we are trying to utilize all the resources. And a lot of that is just preparation so that we can make sure that in the event, again, that we get to the point where they don't want any transportation, that we're still able to get their funds to them. We are still having to have them obviously sign documents. I don't know if we will ever have to go to an online document signing. I'm hoping that's not the case. Because we would have to that would only work for some documents rather than all of them, obviously. Right. We are still able to do face-to-face intakes when a birth mother comes into the program, but we've had to make a lot of drastic changes. Like when a mom goes to get an ultrasound, we're having her Skype with us because we can't go back with her. Whereas we normally go back and hold her hand and, talk to her through it and make sure she's doing okay. And we're not able to do that right now. Right. And it's really scary because they look to us as their support structure. And when we used to be able to go and take them to lunch and spend time with them and really, get to bond, now we're using Skype and Zoom and not able to spend that one-on-one time like we used to. Right. Now, how are they taking it as far, obviously they can't be, they've got to be understanding of the situation. Oh, absolutely. I have to say that all of our birth mothers have been incredible troopers. Good. They understand completely. They themselves do not want to get sick. They do not want to contract the virus either. Or spread it to other people in their families. Right. Agreed. And so they are, sheltering in place as well. And they are, holding it together. They're doing an amazing job. But they're scared and they're struggling just like everybody else. Right. The adoptive families, when we explain to them that, we've had to do a shift in case management just to keep everybody as safe as possible, because as the director and looking at the whole scope, there's really, a triad here as well, where we've got the birth mothers and the adoptive families and then the agency staff. And I've got to make sure that all three entities are as safe as possible. And yet we still want adoptions to be successful as possible. But at the same time, safety has to come first. And so we are doing everything from, like I said before, sanitizing the offices daily, to making sure that, when we go into the hospitals, we're not allowed to be there anymore for labor and delivery. That's a big question that we get. They're not allowing a support person to come in at this time. They've changed the protocol a few times, but right now they're not allowing anybody else in.
Not even one other person in the room, even
in
family.
Some hospitals, they're allowing it. In others, it's not really uniform.
Okay.
It depends on the hospital. But what we are allowed to do is when we have documents that need to be signed, like a power of attorney, they are letting us go in and get that paperwork signed as long as there's not another support person already in there. But I mean, they're taking our temperature before we're going in, and we're gloving up and wearing masks. And, we're even wearing masks and gloves in the office.
I was going to ask about that. So you have those on supply for your staff and the birth mothers that come in, for instance?
We do.
Okay.
Yep. Everybody who's coming into the office has to wear gloves and a mask, regardless of whether or not they're feeling ill or not, even though the office is sanitized, because again, we really want to promote safety. We're dealing with pregnant women, and there's so much unknown about COVID-19. There's so much that we don't know yet, that we're still learning. As a world, we don't know enough about this. I have to say that it was scary. I mean, when the pandemic first broke out and you couldn't get groceries at the grocery store because everybody was rushing to the grocery store and buying everything off the shelves, and that's still happening. We had actually reached out on Facebook and asked for any extra donations of non-perishable goods that people may be willing to part with. And it actually made it onto one of the news websites that we were looking for donations. So that was really nice.
That is very nice. Now, how is your office doing as far as, this is the question that everybody's been asking each other online. How are you doing on toilet paper?
Right now, we're okay.
Okay, good.
We also don't have the influx of people like we used to, because again, we're doing so much more of it from home.
Okay, so it's not getting used as much.
Correct.
Okay.
It's not getting used as much, and we are part of a business park. And so that's what, that's their obligation to provide it. But at the same time, we have backup if we need it. So we're okay on toilet paper.
Good. I'm glad to hear that.
Our birth mothers were more concerned about our food pantry and making sure that we had food for them. And we do.
But donations are always necessary for this.
We do, but it's not what it used to be.
It's thinning out.
And I know that everybody out there is really concerned about food and toilet paper and all that. But anything that anybody is willing to donate, as long as it's not perishable, we would be really grateful for.
Okay. And where do they send that?
What they can do is they can either send it to our office at the 8433 North Black Canyon Highway, Suite 152, Phoenix, Arizona, 85021, or they can ding dong ditch at the office.
Haven't heard that term in a long time.
Yeah, they could drop it off at the office, and our receptionist is there, and she won't open the door, obviously, but when you're there, but she will take it, and we would be very grateful. So it is, it's always a concern for the birth moms, because our food pantry is something that not any other agency that I know of even has or hosts.
Really?
And St. Mary's Food Bank is one of our major contributors for food, but because of what's been happening, they haven't been able to donate like they used to.
Right. Certainly. There's a community need that they have to just take care of first. And we totally understand. And we're grateful for everything that we received and will receive in the future. And that's totally understandable. But it does put us in a little bit of a predicament. So we've done everything from ordering on Amazon and Walmart in bulk as best we can. I know some of our staff members have donated food. I know we've donated food just to try to keep things going. Remember that those donations can be dropped off or sent to 8433 North Black Canyon Highway, Suite 152 in Phoenix, Arizona, 85021. Visit Building Arizona Family's website at azpregnancyhelp.com We have a new website for the podcast, birthmothermatterspodcast.com. And as always, remember to rate and review us wherever you are getting this podcast. We really, really appreciate it. Join us next time on Birth Mother Matters in Adoption. For Kelly Rourke-Scary, I'm Ron Rains, and we'll see you then.